A whisper of despair lurks in the delicate fabric of the mind, with profound and suffocating feelings of sadness, an emptiness that casts a dark spell on all the bright and enlightening moments of life, turning them into hopeless traumas. Depression hijacks a person's mind and makes it suffer in silence. Depression makes a person relentless, draining all the energy and leaving him with no motivation to do anything better. All the little joy means nothing to a depressed person. Anxiety, lethargy, and feeling worthless are the critical features of this silent, haunting predator. Let's move on and get a grip on tackling this unseen foe. What is depression or depressive disorder? Is a psychological state which is characterized by feelings of sadness, low self-esteem, and lack of interest in any of the activities that provide pleasure and can be enjoyed in life. This mental disorder affects 3.5% of the population worldwide and 7% of the individuals in the United States. It is a normal thing to feel sorrow over any life matters like the death of a close one or being jobless. But if those feelings of grief and sadness continue for more than 2 weeks, then it is characterized as depression. This condition is known as clinical depression or major depressive disorder. Depression also disturbs eating and sleeping patterns and causes behavioral issues like harming oneself or attempting suicide. Relations with family, friends, and social life are severely affected by depressed behavior. People who have bipolar disorder also suffer from severe episodes of depression. What are the types of depressive disorder? Clinical depression, major depressive disorder. It is the most common and worst form of depression. It is characterized by feeling low self-worth. This depression remains for 2 or more weeks, with sad feelings and losing all interest in activities that could be a source of enjoyment in life. Persistent depressive disorder, PDD, disturbs a person's life for at least 2 years. It has less severe symptoms than clinical depression. The symptoms can persist for a longer time in life with moderate intensity. This type is also known as dysthymia, disruptive mood dysregulation disorder. It usually affects children, and symptoms become apparent at the age of 10, with intense and frequent anger upsurges. Premenstrual dysphoric disorder. This type of depression is associated with premenstrual syndrome, PMS. Severe irritability and anxiety disturb the person, particularly females, during the onset of periods. Depression due to underlying medical conditions. Severely depressed mood swings are initiated in patients suffering from hyperthyroidism, Parkinson's disease, cardiac diseases, or cancer as a result of biochemical or hormonal changes caused by such diseases. The major depressive disorder has also some particular types. Seasonal depression, this subtype of clinical or major depressive disorder, usually begins during the onset of winter, and symptoms improve when summer or spring arrives. Prenatal and postpartum depression. Some pregnant women often experience prenatal depression during the course of pregnancy. However, few women become depressed after delivering a baby, particularly after 4 weeks of the baby's birth. This sort of depression is termed postpartum depression. Atypical depression. It includes mood reactivity, as optimistic activities and events can make the depressed person feel good. This is different from typical depression, as its symptoms consist of an increase in eating habits and being afraid of being rejected by someone. Who does depression affect? Mostly, females face depression more than men, but it can affect people of all ages. However, particular risk factors increase the rate of depression. Alzheimer's disease, Parkinson's disease, stroke, multiple sclerosis, macular degeneration, cancer, and chronic pain are risk factors that are more likely to develop depression in patients suffering from such diseases. What are the factors that cause depressive disorder? Neurotransmitters released by the brain play a crucial role in maintaining the brain chemistry. These chemical messengers are produced in a very balanced manner in the body. A disproportion in the amounts of neurotransmitters, particularly serotonin, norepinephrine, and dopamine, leads to mood swings followed by sadness and low self-esteem. Genetics can also be the cause of depression. Having a first-degree family member with depressive disorder is also an essential factor in developing symptoms of depression. Another cause of depression includes life events that cause stress or sadness in a person's life. Those traumatic events may be divorce, the death of a loved one, financial insecurities, being jobless, injury, stress from work or job, sexual or drug abuse, and many similar issues like that. Some medications have side effects that increase the chances of developing depression in a person who is receiving treatment for certain illnesses. Treatment with alpha interferon is also reported to induce depression in the patients. Similarly, isotretinoin, which is used for treating acne, is found to have strong links to depression. Likewise, anticonvulsants, anti-migraine drugs, and antipsychotics are also associated with increasing the risk of developing depressive disorder. What are the symptoms of depressive disorder? Depression can affect both children and adults. Depressed people feel pessimistic and do not see any light to enlighten their hearts. Depression makes people worried and extremely sad. They are always frustrated, low on energy, and do not enjoy little things that can make them joyous. Their eating and sleeping habits deteriorate as depression progresses. Some people overeat and gain weight, while others do not feel hungry, therefore, their weight is lost faster. Individuals with depressive disorder face difficulty in sleeping, while some sleep too much and suffer from hypersomnia. People with depression have trouble making the right decisions and recalling things. Headaches, stomach aches, and sexual dysfunction are also the symptoms of depressive disorder. How can you diagnose depressive disorder? The doctor asks for your medical history and observes your symptoms and mental health. There is no laboratory test available for diagnosing depressive disorder. This can only be identified by physical findings. However, blood tests can be done to identify any medical condition that is associated with developing depression. How can depression be treated? There are several treatment options available. Psychotherapy is a better approach, particularly cognitive behavioral therapy, CBT. In this therapy, the mental health therapist, through a question-answer session, closely observes how his thoughts and emotions change and how they affect the patient's actions. CBT can help provoke positive thoughts in a depressed person and eliminate any negative thoughts in their minds. Through CBT, a depressed person can feel better and also get a grip on dealing with stress and painful events. Another treatment option includes antidepressants. Antidepressants play with brain chemistry, stimulating various neurotransmitters and therefore alleviating depression symptoms. Antidepressants include selective serotonin reuptake inhibitors, SSRI serotonin/norepinephrine reuptake inhibitors, ENRI serotonin modulators, and monoamine oxidase inhibitors, MAOI. Complementary therapy, including acupuncture, massage, and hypnosis, is also a treatment choice for patients having moderate depression symptoms. Brain stimulation therapy is an effective treatment option for patients having severe depression symptoms or suffering from depression psychosis. This therapy includes electroconvulsive therapy, transcranial magnetic stimulation, TMS, and vagus nerve stimulation, VNSA. How can depression be prevented? Properly maintaining a sleep routine, maintaining healthy eating habits, practicing yoga, exercise, and meditation. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.